welcome to our panel, and you're
Okay.
a panelist.
That's
So
perfect.
if anyone has initial questions for Gabrielle, they could ask them as people are coming up to assemble. So if our panelists could please join us up here. Microphone. So this is a question for Gabrielle, we think?
Actually, it's a suggestion and something you might want to explore with Speck. Is we heard of a very good study that used kiosks in laundromats, because I noticed in your demographics it was kind of high income and kind of, college educated. And if you want to reach a different demographic, you have to think of someplace else besides libraries.
So so one challenge there would be how do we get the Speck sensor to people? And that's why we decided to go with the libraries. And there are a couple of libraries that we worked really closely with to really try to get the word out. One was in a neighborhood called Hazelwood, which is a lower socioeconomic status neighborhood. And unfortunately, we were only, I think, able to get 3 people there interested in participating in the study. However, I didn't say the numbers there. Although 62 people were interested in participating, literally hundreds of people have checked out the Speck monitor. So we don't actually know how it has impacted those individuals who decided not to take the survey.
And I didn't mean necessarily a laundromat for this project, but that idea of someplace that's patronized by.
Yeah, I think that's a great suggestion.
Well, it may not be that great from a research perspective. I could imagine allergy clinics where doctors are telling families to do all these interventions without really any data on whether it works. This would be a very good way of kind of promoting that sort of activity. So we have 3 people on our panel who I don't think you've met yet, so I'm going to let them introduce themselves and say a few things. Anne, start with you.
Hi, I'm Ann Bostrom. I'm from the University of Washington, where I'm at the Evans School of Public Policy and Governance. And I work on risk perception, risk communication, and have had the pleasure of working a little with Gabrielle and a lot with Baruch in the past. My work focuses primarily on people's causal beliefs about hazardous processes.
And I'm Kevin Elliot. I'm at Michigan State University. I'm actually a philosopher of science, and so I do work on research ethics and sort of social responsibility surrounding science, and questions of how ethical and social values do enter into scientific practice and how they ought to enter into practice.
And I'm Gary Ginsberg. I'm a toxicologist and risk assessor for the Connecticut Department of Public Health, teaching appointments at Yale and UConn Health Center, and I'm a member of the Emerging Science Panel.
So I think one of the things that we kind of saw there was this idea, we've been talking about all these monitors, but we haven't really been talking a lot about, do they work? Are they doing what we think they're doing, and are they helping in this way? And I think what Gabrielle showed was a great way of kind of touching on that evaluation, but it'd be nice to hear from the panel about other ways they kind of see about evaluating the use and how it's being interpreted, and how we can kind of go through and really make sure we bring science to the deployment and evaluation of these instruments. Whoever wants to go ahead and go.
Yeah, so in terms of public health science on the impact of PM on population health, we've got the outdoor data on populations at risk for cardiopulmonary disease and the impacts, even at low dose without an apparent threshold, on mortality. And that is probably mostly related to mobile sources. And then on the indoor side, we have some research on cooking-related nitrogen oxides and health of children, both in terms of ability to fight off infections, as well as I think some asthma data now that's emerging out of Yale. So that's nitrogen oxides, that's not PM indoors. So in terms of doing a lot of measurements and characterizing things as bad indoor air quality based upon a device like what we're talking about, I think we have to be very careful, unless there's data that I'm not aware of, very careful about characterizing things as bad air quality because of the concerns and the fears that's going to raise in people. And I don't know if we have the data to explain exactly what those spikes from cooking burning chicken, as we heard somebody else say, and of course, burning anything is not a great thing for your indoor air quality. I would agree with that, but I just think that, for example, the diesel measurements we made at train stations is probably qualitatively different than when you're cooking, in a fry pan. So I don't know that we've got the data to say exactly what cooking in a fry pan means. And the other question I'd have for people who are getting this kind of data is, what does cleaning activities do? Because in cleaning activities, you've probably got aerosols that do have some irritant chemicals in them that are being sprayed around more than just shaking a rug and creating dust particles. So that I'd be very interested in seeing what cleaning does to these monitors. But those are my initial comments.
So can I respond a little bit to that? Because we actually also have a study where we use the Dilos, which just counts particles, and we put them in people's homes, and we actually fed back to them the information about, we had them log when they were cooking and things like that. But people said to us, even before we gave that information to them, that they could see just the particle numbers go up when they did different activities, and they were very interested in that. And so that's definitely one. I think the point, though, as to what is the relative, importance of different types of particles from, say, cooking or cleaning to your health, or cleaning aerosols, we don't really know that very well right now. And actually, another point that's interesting is because we try to calibrate, so to transform that particle count data into the concentrations of micrograms per meter cubed. And it actually is not a very simple thing, because often we use the ambient reference monitors to calibrate these sensors, but your indoor aerosol is very different. And so we found actually that, there are studies that show that they look at cooking versus cleaning, and they have different curves. So actually, how well we can translate that particle count data into something that's a health-based measurement is, I don't think it's so straightforward. And it leads me to wonder also, we've talked a lot about whether particle counts actually are just as important, and maybe we should think about different ways of representing that information, not just only using what is, the mass concentration as well.
Just to follow up on that, so there does seem to be a tendency to think about reference points, and in some of the papers that for background reading pointed out that the reference points that were not provided, when reference points were not provided, people were not interested as interested in the data. And tell me if I'm misinterpreting your papers, Phil. But the reference points that people do get, they may pay too much attention to. And there's a lot of research and judgment decision making showing that people anchor on the kinds of reference points they have, and giving those an evaluative status, like saying they're bad or good, can have a very big effect. So especially when the research community is uncertain about what the appropriate reference points are and what the data mean, it seems to me like it's really important to provide some communication of the uncertainty around the data to people who are getting the numbers. I mean, you see those curves and they look like they're absolute, and they're just like, oh wow, this is exactly what's happening. And it looks like, it's got to be bad for me if they're measuring it, right? So there are a lot of implicit evaluative components of the communications that are being made already. And so doing systematic research on the use of comparisons and reference points and the provision of the data, both numerical and visual, would be really helpful.
Gabriel.
I think I would also just like to echo that, and I think evaluation and more thorough user testing as well, and kind of I authored a paper with Baruch and another person, Ben Strauss, who I think was mentioned earlier, on designing effective interactive decision aids, and there are basically 4 criteria. One is knowledge. Do people learn from using the decision aid? Can they actively master that information? So basically, are they able to make logical inferences from the information that they've learned? Does this inform their preferences? Are they making decisions based on what they learned that are aligned with their preferences? And so I think that type of careful user testing is really important and goes beyond just, okay, we know with respect to, for example, kind of web design principles, that people are notice colors like orange more, or we know about the orientation of figures and kind of the text we should use and the colors we should use. But I think that type of evaluation of the content is really important. And I think that, in my opinion, monitors like the Speck sensor could probably be improved from doing that type of careful testing.
Kevin?
I was just going to note also, when we're thinking about evaluating these sensors, I think it's important to think of the range of different goals that we have and that different users might have. So, some users might really want individual information on how they can change their behavior, but we might also think it's really valuable just for users to become more educated about the fact that they're being exposed to things, and this can apply in lots of areas of their lives. And as Phil was pointing out, we also don't want to just focus at the individual level. We want to consider, is this fostering the ability of communities to make a difference and to foster change? So I think it's important to consider, these range of different goals. And I think one of the challenges with effective communication, we've been hearing about the importance of having a sort of a focused message and the importance of framing and not just data dumping. But depending on what goals we have, we may need very different sorts of communication. So maybe on that point, I love Dawn's point about the communities of interpretation, that maybe if we foster multiple communities for interpretation, well then, depending on what people's goals are, their goals are more likely to be met. So.
Gary?
One other lens to look at this through is that the reason why buildings became much more airtight after the energy crisis of the 1970s was, and the way we started building buildings much more differently, and in one sense turning them into exposure chambers. But on the other side, making them much more energy efficient, is that, energy costs and climate change and all those considerations are on the side of why we don't open windows in the wintertime and turn on necessarily a lot of extra fans. And so by telling somebody you got a spike, so just open a window, may run counter to some of what people are trying to do on their energy dollar, just as a consideration, just as another, thing that people may think about in reaction to what they're seeing on these monitors. But from a health study side, we can measure, there's some fairly sensitive indices of inflammation that you can get in exhaled breath, exhaled nitrogen oxide, which you can get a quick sample of, or measure in a small population of people over the course of a day, and without them knowing what the track of the PM is reading, and compare. And I would think that that's a natural kind of study to do, or do some sporadic over the course of the day, airflow measures, FEV1 on people in response to or in relation to their PM exposures around the house from cooking, cleaning, whatever they're doing, especially in asthmatic children. There's inhaler use. So there's a variety of endpoints that we could be using to look at the indoor environment in relation to something like PM. And then just completely out of this box, but into another box, is we actually do have, I believe we still have on the record, a 1-hour knack for ozone. And if people could come up with an ozone real-time monitor that would be relevant both outside and indoors. Of course, indoor levels of ozone are much lower than outdoors because ozone's so reactive, it just reacts out on all surfaces. But ozone is very relevant to asthma and health effects. And I think it's not as hard to interpret in terms of ozone's ozone. It's not a cleaning aerosol versus a cooking aerosol versus something from heating oil. So I think that would be, a real advance if we came up with a way to real-time monitor ozone for people and their behaviors.
So on the indoor side, is that one of the advantages of indoor air monitoring is that you can have a fixed monitor, and this has been being done for decades. But it would seem that, what are the barriers to introducing these sorts of inexpensive home sensors and testing them against some of those existing research methods, like you say, when you can pick up a host of different gases and things and compare those head to head? And I just wonder, why more of that hasn't occurred when a lot of the indoor monitoring is already being done. How do we layer on some of these new tools and actually test to see what they're measuring head to head? Is there anyone, I haven't heard much of those things going on, but it would seem to be a logical type of experiment to do. Did you?
We've done a little bit of that, but you know, some of the instruments are quite large to port into someone's house, for example. But I think it is something I guess I've mentioned this before, I think we do need to do a lot more testing of these instruments in different environments, just because we are exposed in a lot of different places. So, but yeah, I agree. I don't know why there actually hasn't been done that much. It's a good question.
So on that topic, we have a question from Greg Sawinski online, and he says, any experience in having these devices placed in the workplace, and can an employee collect data in their workplace on their own?
I just want to mention that that participant bought 3 for his workplace, and he put them around. And I think he got data that was good enough to get the landlord to make some changes. So that just one story is it being used in the workplace? Yes, but I don't think in the way that the questioner meant, but as a tool to get something done. So it was kind of like an environmental justice issue there.
On a related note, it does seem like in encouraging people to be air quality detectives, you could also encourage people to use multiple sensors and to look at the variability and encourage that kind of increased capacity to do experimentation by specific users so that they can generalize more from their own experiences. It's not, I mean, as a layperson in this arena, it's not clear to me how localized the data have to be to be measuring what you're actually inhaling. I was a participant in a study at the University of Washington. I'm part of the Twin Registry there, and we had these experimental particulate PM exposure devices that were being developed, and they told us we could carry them any way we wanted to, and we could set them down when we were indoors. And yet in some of these other studies that we've heard about, they're very particular about 10 inches within inhalation zone. So it raises a lot of questions about the quality of the data you're getting and whether they're meaningful.
Gabriel, I have a question, and if the answer is what I hope it will be, then a follow-up. There's a group that was called something like the Southwest Pennsylvania Environmental Organization that was doing a project with Specs, and that was around fracking. So I wonder if you could talk about that, and then if I could, just to follow up about how to compare that with other relevant data.
I know of them and what they've been doing. I don't know yet what their results are, and I wanted to work with them actually on another project having to do with preterm birth. So we were interested in coupling that data with some of the feedback we were getting from pregnant women.
So the other part of the question then is, it's a comment. People might have seen the Ginsberg Health Systems did a study showing a strong relationship with asthma and fracking. And, as a large health provider, they wanted to find out what the effects would be. If there was some way to merge data coming from the Southwest Pennsylvania group and that Ginsberg study, that would be really tremendous. So yeah. I think going forward, this is partly an answer to, environmental justice and, affected communities at a community level, but also being able to integrate that with really large, solid clinical data.
And
just 2 more comments related to that. So this brings up an issue that I believe Don brought up earlier today about data interoperability and being able to exchange data across platforms. So encouraging this as a research community to create data that people can link with other kinds of data readily and easily. And in some other domains, like in the engineering domain, there are huge efforts to try to put data onto platforms that can be linked to other data readily and to facilitate the use of linked data. So that's the domain in these sorts of personal exposures. If you could do that now so that biomonitoring data and exposure data could be linked more readily in future and for longitudinal studies, that would be very helpful. And then the other part of this is that I want this a related tangent, though. It's not clear to me who's evaluating the devices. It's not necessarily regulators. Is it the commercial providers? Are they evaluating the devices, and to what extent? Our researchers are clearly evaluating the devices to some extent, but a lot of these are now commercially provided. And it seems to me like the approaches to evaluation will, and probably do already, vary depending on people's resources and aims. And so unless there's an effort to create a community of device developers who have standards for evaluation that are widely shared, or that actually help meet research needs, it's the Wild West, right?
Kevin.
Actually, I just wanted to follow up on Ann's points. I think those are both really good points, and maybe we can keep them in mind tomorrow. I think perhaps the last session is talking about the role of different institutions.
Right,
I wonder if there are significant roles for federal institutions in both of these points, both data integration and in thinking about standards, trying to validate these, look at the relationship between the results from some of these instruments and, regulatory standards of higher quality instruments. So.
And I think that we can, bring the conversation up to that point today, and then tomorrow we talk about it. But for example, for the developers, and the companies and the marketers, what role do they have in this? And I think that's where we can bring the argument there, and then tomorrow we can talk more about the policy and government entities sort of role in it. So, Gary, yes.
On the issue of calibration, I did look at the documentation online available for the Speck, and it said that there is a one-time, factory calibration of each unit, and if they're out of spec, they don't go out on the market. But from other devices we've seen the public use that are factory calibrated, that's from the factory, and then we see a change over time, and that sometimes devices need to be recalibrated and just don't work as well over the vagaries of time. What it said about that for the Speck is that you're supposed to, after a couple of months, blow a stream of compressed air over the through the device to clean the lens. And I don't know how many people have that and are going to do that. So one thing that we've seen that's a fairly serious issue that's relevant to this conversation is fairly common. People are using natural gas fired, unvented heating devices in their homes. And they can be a source of carbon monoxide and nitrogen oxides if not properly calibrated, because the way they work is they have an oxygen sensor. And so if the oxygen level in the room goes below a certain level, they cut off. And we've seen those oxygen sensors not hold up over time. And that becomes a carbon monoxide risk from running those devices. So just, from that perspective, just how do we know the calibration is going to hang in there on a device like this?
So I'm hoping that someone in the room from EBA can follow up on this comment from online. A viewer states that EPA's Office of Research and Development in the South Coast Air Quality District programs test and evaluate air quality sensors and report the findings on their website. The question is, how comprehensive is that testing? Anyone have more detail on that?
Actually, I'm Rich Kellen from EPA, so
there you go.
I'm actually going to speak to that exact same thing. It's very coincidental, but so the South Coast Air Quality Monitoring District, which is part of the state of California air monitoring, they actually have developed a really extensive database on that, and they continue to test those sensors. They've been publishing all the results online, so that is one resource. And also, EPA also has the Air Sensor Toolbox for citizen science, which is a toolkit that's available online as well. To evaluate the instruments that are out there, but the South Coast Air Monitoring District is a great resource that they continue to develop, and also I was going to mention that we have a set of 6 projects that we've recently funded. Edmund Cito is part of one of the groups of the grantees, and it's called Air Pollution Monitoring for Communities. So it's 6 projects around the country that basically have academicians and institutions working with communities to evaluate the sensors, evaluate community concerns about the sensors, how communities will interpret the data, and actually do a lot of quality assurance and quality monitoring of the data to make sure it's good quality data, and post the results on websites and make them publicly available. And so actually South Coast Air Quality Monitoring District is also one of the grantees in that set of projects. And that's through the EPA Office of Research and Development. So.
Yes. Yeah.
Comment. I think I think it's good that actually somebody is doing it, because there isn't really a unified, like, let's take all the sensors and test them all in the same way. But there's also two things. There's the sensor itself, which is a thing that that reacts when it comes into contact with the air pollutant or whatever it is in question. But then there's also how the device is built, and both those things are important things. And I think that's something we haven't discussed is, what are we interested in? We need to know that both work well, and everybody develops their device slightly differently. So it's not just, how well does the whole thing perform, but it's like, do you shield it properly? Do you have proper airflow? And they will perform differently in different environments. I can tell you, living in Scotland, our sensors didn't work very well there, but they worked fine in other countries, for example, and they were the same sensors. So I think there's a lot of, perhaps, like you said, it's a bit of the Wild West out there. Lots of people can buy stuff online. And I know in Europe that they're trying to come up with sort of like a data quality objectives for sort of this type of device, but perhaps there needs to be a little more kind of a community that is produced that actually looks at testing these things, so that at least we know they're all tested in the same way, and that we can compare them, even if it's not, if they're tested wrong, at least they're all tested wrong the same way, or something like that. But we could have some quantitative recommendations that everyone can follow, if that makes any sense. So.
I think with the sort of like quantified self community, I mean, if there's enough people that are potential users that demand that sort of testing, it's something that could really percolate up from the user base. So you have a question over there? I was going to shift topics. Do you have a comment?
I'll just make a really quick comment about those EPA projects. I think pretty much all EPA projects have these things called QAPs, Quality Assurance Project Plans. So it'll be really interesting with, these new generation of funded projects from EPA, what those QAPs look like. And perhaps there's some best practices that could emerge by looking at those.
So one of the things that we've been talking a lot about air pollution. I think part of that is because the clear link to many health outcomes, but it's also been just from a technology development, they're farther along. But as we talked about earlier this morning, is that there's other things that can be measured. Our air quality, I mean, like water quality and, residues in food and things. And I think it'd be good for us to spend some time to think about how much of what we've talked about would be applicable to that. I mean, I think with what happened in Flint, people are much more concerned about their water. They can have their water tested often at ag extension services or soil in their yard. And really the testing part of it to measure contaminants in water, the technology is there. It's just not really a consumer thing, but often they can get those things tested very readily. So, are there different issues when you start thinking about water where, as Amy pointed out, the regulation stops at the curb and it becomes much more of an individual homeowner issue or even a apartment unit or something? Anyone want to comment on non-air sort of sources of contaminants or pollutants?
So I'll say something because I also work in non-air, but actually, I was talking with Amy earlier, and so I used to work in a community in Arizona, and we were looking at water, soil, and dust, metals specifically, because it was near a Superfund site, and there were a lot of private well owners there. And the thing is, after we did the study, we said, what we really recommend is you need to test your water, because there's a lot of homes with high arsenic content, especially. But then it was kind of like people they were like, well, we have to spend all this money, to send it to lab and things like that. And it would be nice if they could have the equivalent of an air spec for their water, and they could just stick in their faucet, and it would tell them at least some idea of, how much of these metals or whatever it is you're interested in would be in there.
Sure.
Yeah, I mean, we've recognized that we have some hot spots in groundwater, natural deposits of uranium and arsenic, and so we have made a big point of trying to have homeowners test their wells. And a lot of people don't want to know. When the question came up before about motivation, I mean, if it's affecting property value and you have to sell your house with a major plumbing fixture on it, that is, definitely a factor. People start going down that path. Besides the cost of testing, it's the cost of mitigation if you find out a problem. The water, the rule of thumb we've been using with lead is that we thought that public water supply, even if you're on a public water supply, and we thought public water supplies, because they are neutralized in a way, they don't have a high leaching water based upon the lead and copper rule, that you probably wouldn't have a problem at your house as long as, you don't have that much plumbing. You just do a flush of your water every day before you drink it. But now we're seeing that even with the lead and copper rule, a lot of public supplies still have difficulty. And what we tell people is that test your water, both full flush and without flushing. And if the results are radically different, that's a good thing. That means that your local plumbing isn't that extensive. I'm sorry, that the distribution line doesn't have that much of an impact on your water, because you can flush out the lead. But if even after a full flush you still have high lead, that means that the distribution system's the problem, and there's a lot of it, and you're not going to be able to simply take care of your lead drinking water problem by flushing for a minute. So there are some rules of thumb, but we even in a public supply that's well monitored, things can change, and we recommend now that people test even for something as basic and well known as lead.
I think that's a really great point that you made kind of early on in your comment, that people may not want to know, and they may not want to know for a variety of reasons. And I think that that's something we need to think about in terms of communication challenges. So, for example, some of the work that I've done in coastal areas that were impacted by Sandy, I was working with some nonprofits who wanted to develop a resiliency plan, and they didn't want one in their community because that would be stigmatizing. We are a community that is vulnerable and at risk. People won't want to move here. If they see that I put my home up on pilings, they're going to see that bright red flag. This is a bad place. We just don't want to know. We don't want to know what the risk is, and we don't necessarily even want to know what to do about it. So I think that's something that we need to keep in mind, especially for communities that feel disenfranchised. We've been talking about EJ a lot. Do they have faith that something will change, even if they find out something is bad? Do they trust the government to do something about it?
And I think an easy follow-up to that is that how did you become aware that they didn't want to know that information?
We did town hall meetings, interviews.
Right, it's about community engagement, right? I mean,
Yeah.
if you didn't have that engagement, you may have missed that, and then
Yeah.
it would have really kind of undermined the trust piece of it. So, yeah, Kevin.
I was just going to mention really briefly, this I think connects back nicely with Linda Birnbaum's points this morning, the emphasis that NIEHS puts on connections, engagement between researchers and communities, and I think that's a real strength of the Institute and something that we need to emphasize, to be finding out, well, what do communities actually want and what don't they want, and what are their priorities?
Yeah, Gary.
And when EPA was releasing for the first big public release of the Cumulative Exposure Project, which was air quality data across the country, it was all modeling based upon stationary sources and mobile sources and a lot of modeling. The major pushback about that release was the Council of Mayors, because it highlighted urban air quality as a problem. And so again, people having to deal with the fact that they are toxic town or bad air quality town, that's the messaging there has to be carefully distributed.
One of the things we found in a community in Atlanta that we've done some work with in one of our center grants was there was a lot of flooding, and they get a lot of bacterial contamination. And that community really wanted to know, and they wanted evidence to go to the mayor's office. And so that's what they wanted. We helped deliver that information to them to really help with some of those interventions. So it is really critical to find out what those needs of the community are. So I don't see any other questions. And Keegan told me that we were allowed to finish early. So if there are any last questions, Gary's raised his hand. We're not going to.
Just one more point, hearkening back to the outdoor PM monitoring that Michael was talking about before with a habitat map. One of the issues that I've seen come up is the siting of schools and daycare centers and proximity to highways and, you know, bus routes and things. And I think that this technology of being able to identify local hotspots may help understand local exposures, local risks that are already in place from the unfortunate sighting already of roads near where people live and where children go to school, but also down the road it may help in future sightings. So I just think that, again, that concept that you brought up may help us in civic planning a lot.
Kevin.
Before we wrap up, I was also just curious, you know, you asked us initially our thoughts about evaluation of these, and you mentioned, Gabriel, that the users have a Facebook page, and I was wondering, to what extent has that been helpful at all in evaluating the usefulness, or have you gleaned useful information from seeing what has gone on in terms of discussions there?
Yeah, we've seen a little bit of that where people are like, you know, I did some experimentation. I found out, you know, these associations between my activities and what the PM levels are, and this is what I did about it. And then people like it, or they comment and like, oh, I tried that and it didn't work for me, or that did work for me. We also see a lot of complaints. It's kind of, you know, as you would expect from Facebook, it's just everything. People are posting everything. We actually also found anecdotally with some of the interviews is that, and this I think goes to kind of taking it from the inside and taking it outside in terms of kind of community empowerment, that some people are posting their findings on Nextdoor and being linked to, and they're making these associations between their indoor air readings and what is happening. So if there's a big release from a local chemical plant or something, they'll say, oh, I noticed something happened, you know, and then it starts a conversation, basically. So those things we haven't been able to measure as well, but we are noticing it, and probably warrants deeper investigation, more rigorous investigation.
Yes, Ann.
One more question for you, Gabrielle. So has Speck since thought about having an Ask an Expert component on the Facebook page so that people could actually ask the experts what they think of their activities to try to reduce their exposures?
I think that's an excellent idea. They have an FAQ and some, you know, it's basically one person kind of responding from time to time. I think it just probably takes someone who's dedicated, and this is what, you know, every week or every 3 days they respond to questions, but it isn't that that consistent, and I think that actually would be really helpful and maybe get to some of the questions that people had. I forgot where the individual is with respect to the comment about, okay, I get calls and people don't know how to interpret this or what to do. I think some of this could be handled by some of the providers, kind of helping to alleviate fears or provide advice.
One
I
more
want
question over here.
to thank you know, everybody for a terrific day, panel, everything. I was just thinking, one of the things these sensors do basically, well, so going back to the 50s, 1960s and so forth, you know, you had a river catch on fire, you had horrible industrial pollution in some places, you could actually see it in the air. We have it today in places like Beijing, as we all know, places like India. But now, as a result of the regulations, the National Air Quality, Ambient Air Quality Standards, you know, the air's a lot cleaner than it was. I mean, one of the earlier speakers had mentioned how the 2007 change in regulations on motor vehicles and trucks, you know, has made those a lot cleaner. You can measure that. So what these sensors do to me is they make the invisible visible. You know, what we had before was visible pollution. Everybody could see something was wrong. Now it's this invisible thing in the water. We can't see there's lead in the water, but a sensor can tell us that. So these, like a microscope, you know, these sensors enhance our perceptions, enable us to see things we couldn't see otherwise. So the question is then, what do you do about it? And the answer, at least in the past, was we need a regulation to change the motor vehicle standards, you know, so that the engines are cleaner. We need a lead and copper rule to make the water cleaner, to get the lead out of the water. So that is that is really EPA's mission to, you know, protect human health and the environment. You know, but also communities can do a lot in terms of now having these sensors to be empowered with the data to then go to the government, whether it's the state, local, state, or federal government, and say, look, we've got data showing something needs to be done. What are you going to do about it?
So you've made my closing comments very easy. And that's a perfect segue into what tomorrow's meeting devoted to, is thinking about the practical considerations and what can be done at a government level, a regulatory institution level. And that's why we schedule it this way. And tomorrow we'll go into that in more depth. So I'd like to thank our panelists and everyone that spoke today. And we'll see you tomorrow morning. That wasn't too early.